Good afternoon. I'm Amy Beckrich, RPA's Project Director. Thank you for joining us for the Capitol Hill Briefing webinar. We're excited that you chose to participate in this year's Capitol Hill Day on June 26th. Before we begin, I do have a few announcements. During the webinar, all lines will be in listen-only mode. There will be a Q&A session at the end of the presentation, and you may submit your questions at any time using the Q&A feature, which should be located at the bottom of your screen, depending on your device. Please don't submit questions in the chat box, as these won't be captured or answers. Please use the Q&A feature only. This webinar is being recorded. You will receive a link after today's session, and it will also be made available on the RPA website. Robert Blazer, RPA's Director of Public Policy, will be leading today's session, and I'll now turn it over to Rob.
Thank you, Amy. Welcome everyone. Thank you for being here with us. We're really excited about next week and everyone joining us for our Capitol Hill Day. So to paraphrase John Belushi out of Animal House, where he said, "Who's with me?" We're going to say, "Who's with us?" And of course, our group is going to have nephrologists, practice executives and/or managers, and kidney patients and relatives. And I just want to say that we treasure and cherish our relationship with the American Association of Kidney Patients. Thank you so much for joining us. This year, we have the most states we've ever had. You can see all of them listed here, plus DC. Right now, we have 88 advocates, a number, again, that's the highest number that we've ever had. So that's the most states covered and or advocates representing for a RPA Capitol Hill Day ever. So we're really excited about that. Sorry, I went in the wrong direction there, working out the technology here. In terms of an overview, we have a logistics overview that's going to be presented by my colleague, Lincoln Clapper, who works for the organization that scheduled all the visits for us. I'll do a slide about the current Hill environment and what's going on in Washington, discuss our legislative priorities for 2020, do a couple of slides on logistics and what to do and what to expect, and then discuss next steps and follow-up. And with that, I'm going to turn it over to Lincoln. Lincoln, you want to go ahead and take it?
Thanks, Rob. I will get control here. Okay, thank you, Rob. Nice to meet with you all. My name is Lincoln Clapper. I'm one of the directors at Prime Advocacy. This will be our, I believe, 7th or 8th year working with RPA on this event, albeit this will be our first virtual event. I wanted to spend a couple minutes here in the beginning just to run through some logistics for your schedules for next Friday. Essentially, what we're going to be looking at is just a couple of the modules and run through a little bit of the know-how. So in order to access your schedule for next Friday, you're going to use your laptop or desktop as the best way of getting that information. You can use a tablet or your phone, but it's really not recommended since you're going to be on the phone doing conference calls. So if you have your desktop or laptop available, go ahead and open up your web browser, and you're going to go to that site highlighted in blue here, clients.primeadvocacy.com/attendee/login, and you'll know you got to the right site when you see a field asking for your email address, and I have a screenshot of that here to the left. You don't have to create a password, you don't have to make an account. All you need to do is enter the email address that you registered for the conference with and click continue, and you'll be prompted into your schedule. For those of you who have worked with us or have been a part of this event in the past, you may see a couple options for your different schedules from previous years. So just make sure you click on the 2020 schedule and you'll get thrown into your meetings. Now, once you've logged in, it's pretty self-explanatory at this point. In the upper right-hand corner of each of your meetings, you'll see the status of that meeting. Right now, we have about 80% of the meetings confirmed. So you should see a green confirmed icon in the upper right-hand corner. If not, it will show requested, and it'll be orange, or it will be a blue colored no response, which means we're still coordinating with that office. Going down the schedule, top to bottom, you'll notice the first item is the time. And for the majority of your meetings, you'll also notice that the start times are off by 5 minutes. This isn't a typo. This is intentional, and this was done in consultation with House and Senate IT departments, purely because the vast amount of people working from home is in the millions and millions worldwide. It doesn't matter if you have AT&T, Comcast, Verizon, Zoom, WebEx, whatever. Sometimes at the popular high volume times like noon or 1 o'clock, You may experience a busy tone. And so in order to prevent any technical glitches, we've just moved the meetings back 5 minutes before the rest of the world dials in those popular times. So it's not a mistake. Just double check that. But that is the meeting start time. Also, the time listed is in Eastern time. And I know a lot of you are spread out all over the country, as Rob mentioned. So take some time over the next week and do some conversions. Make sure you're dialing in at the correct time where you live to make sure the meeting starts on time. In the location field, since this is a virtual event, you'll see the information for your conference call line. You'll just dial that number. When prompted for the access code, just enter that information and hit the pound button, and you'll be thrown into your meeting. Very simple. Like I mentioned earlier, if you do experience a busy tone for whatever reason, don't panic. Just redial on that second or third try. You'll get punched through. But this is just something that we're dealing with now in the age of working from home. Below that, you'll see some supplemental information, the party, the state, the district. If there's a team lead, you'll see that information listed there. If not, you can ignore that. In the talking point section, we put a couple reminders just to keep everybody on track the day of. Again, all times listed are in Eastern time. The time listed is your start time. We're asking everybody to dial in about 5 minutes prior to the start time, just so you, the other attendees in that meeting, can get acquainted with each other. If you're running late, that gives you a little bit of a buffer, or maybe if you press the wrong access code or you're having technical issues, you have time to redial before the meeting actually starts. So please dial in 5 minutes prior to your start time. And again, if there's a name in the team lead field, then that person will be leading the meeting. Below that, you'll see a blue icon, a blue talking point, the RPA legislative issue briefs. Go ahead and download that. All you have to do is click on it. It's hyperlinked, and you'll download the PDF file. That'll be all the information you'll need for the day of. So you can, it's live, so you can log in now and you can download that and you can start doing your homework in preparation for next week. The last bullet point in the talking point section will be an item for if you're having any scheduling or technical issues, we'll be listing a Prime Advocacy phone number there sometime Wednesday, Thursday. This is just in case maybe something comes up the day of, you're not gonna be able to make your meetings, or if the staffer didn't join, or maybe you're having some type of technical issue, you can call us and we'll make sure to get any concerns taken care of. And again, that number will be listed there mid next week. Below that is just the list of additional attendees who will be on the call with you. Your name will not be listed there because these are the additional attendees. You're looking at your individual schedule. And so this will just detail who else will be on the call with you. And last but not least is the meeting notes section. This is essentially a blank notepad. Please record as much feedback as you can on the meeting, because that information is going to be really critical to Rob and his team moving forward and understanding how the meeting went. Was it positive? Was it negative? Did they need more information from you? Did they ask for any type of follow-up? All that's really, really critical to their government affairs efforts. So if you could just be as thorough as possible, there's no character limit. Just make sure to click the blue Save Notes button when you're done, and it'll house the information for you. That's an individual notepad, so it's not, you are the only attendee, you are the only person who will be able to see those notes. So each person will be able to write down their own notes for each of the meetings. Couple last slide here, just wanted to run through a couple reminders. Please call in the meetings 5 minutes prior to the start time. Really important, just to make sure the meeting starts on time. All times are listed in Eastern time. If you hit a busy tone, just redial on that second or third try, you'll get punched through, don't panic. If an office does not join the call for some reason within 10 minutes of the start time, please go ahead and hang up and notify Prime Advocacy. Have somebody in your group give us a call and we'll reach out to the office to figure out what's going on. You know, they have staffers and members have things come up like the rest of us. And so if they skipped it or missed the meeting, we'll just reschedule it for later in the day. But the last thing we want is for you to hang on for 20, 30 minutes, just wasting your time. So just let us know if they're not on within 10 minutes, but give them a 10-minute buffer. And then help number, again, will be listed in the talking point section. Our calls were made with the intent of them lasting for 15-minute blocks. For the most part, these are going a little bit longer than in-person meetings, but Just know ahead of time from a logistics standpoint that they were blocked off for 15 minutes. So that will help you in your preparation in terms of getting your pitch and your message ready to go for your meetings for next week. And again, can't emphasize this enough. Please leave as much feedback as possible in the meeting notes section. Will be really, really critical in terms of getting your feedback on how everything went. So we're looking forward to it. Again, as Marab mentioned, this is the biggest project we've worked on with RPA so far, and we're looking forward to a very successful day. So Rob, I'm going to turn it back over to you, and you can take it from here. And again, any questions before I do start? Any questions on this? We're going to hold till the end. I'll be back on for a Q&A session if anybody has questions about the technical aspect of this. So Rob, I'll turn it back over to you now.
Sounds good, Lincoln. Thank you. Let me make sure. Folks, this is the hardest part for me, for what it's worth, is actually making this happen. Oh, there we go. Bless us and save us. The next slide came up. Thank you. Okay, so in terms of what's going on in the current Hill environment right now, it seems as if every year I say we are in unprecedented times, but we really, really are in unprecedented times now. And of course, a global pandemic will do that. In previous years, whether it was the end of the Obama administration and the intense partisanship that was going on there, or the first few years of the Trump administration, where we had a truly unorthodox administration, in addition to the intense partisanship, those times seemed like unprecedented times, but we're really unprecedented now. Now, there's been some massive COVID relief packages that have been passed. They've done 3 so far, and I think the expectation is a 4th will come this summer. And these are both a blessing and a curse. It's interesting, funding concerns are almost a footnote now. Excuse me, in, I believe, the first one of the relief packages, the Medicare extenders package was included in that. And the Medicare extenders package is, excuse me, a collection of bills that are things like, or a collection of provisions, I should say, that are things like Medicaid funding, children's health funding, community hospital funding, that sort of thing. And that normally is a pretty big lobbying effort, $40 billion or whatever. But when you're passing a $1 trillion bill, folding in 40 billion is not that big a deal. And that's what happened in the first one. We were hoping that the Medicare extenders package might be around in May, and we could be lobbying on the immunosuppressive drug provisions we care about, and that I'll talk about later, to be folded in there. But it was already included in the COVID relief package and extended through past the election. So that's why we're going to be talking about that in the fall. And of course, the impact of COVID on congressional attention spans is not helpful, as well as the other mega issues that are out there, like all the social unrest and the police reform efforts that are going on, the elections, of course. There's this effort to get telehealth permanence happening. That's also taking up a lot of the oxygen on Capitol Hill right now. But the thing is, typical congressional work is still happening. I was on the phone with the Hill staffer the other day, and we were talking about everything she's working on. One of the things she said was, well, when COVID really first blew up, I was doing casework in the state, and I wasn't doing any of my normal work, but she's getting back to her normal work now and working on issues that have nothing to do with any of the mega issues, some other kidney issues. So, and the other thing to remember is that enacting legislation is typically a multi-year process anyway. So, for instance, you look at something like the living organ donation bill. That's been on our legislative agenda for a few years now, but we're hoping with, either this year or in the future, in the, near future, that's going to get passed. So typically is a multi-year process. And of course, today's groundwork is crucially important to future success. Again, multi-year process. So, you keep going, and everything hopefully happens for you. In terms of this year's priorities for us, the first is immunosuppressive drug coverage, and you can see the numbers there, and I'll talk about that on the next slide. The living organ donation bill, again, numbers there. The chronic kidney disease bill, this is sort of an omnibus bill of a lot of provisions that people in the kidney community would like to see enacted. I'll talk about how that bill works when we get to that slide. And RPA is also very interested in Congress exercising oversight over the nephrology quality measurement process. This is a big deal for us because the CMS kind of laid out a process 3 or 4 or 5 years ago about how they were going to do things, and then they haven't really followed that process, and that's been difficult for the medical specialties involved. And then we'll talk about other issues as warranted, and this is where telehealth will fall in. I have a slide of bullets about telehealth, RPA talking points on that. So we'll talk about that in a moment. With regard to the immunosuppressive drug bill, the House bill came out right before Christmas, and the Senate bill came out really right before everything having to do with the coronavirus sort of emerged in a big way. And of course, this is the bill, and understanding that for immunosuppressive drug coverage, the current law is that it lasts for 3 years post-transplant. And of course, that's a problem for people who still need the coverage after that 3-year period. So lifetime coverage is the goal. We truly have, I know I used the word unprecedented earlier, but it's appropriate again. We have an unprecedented opportunity to get this passed this year. That's because we have an administration that's completely committed to this. This is all in part with their commitment to kidney disease generally, and the Department of Health and Human Services Assistant Secretary for Planning Evaluation and the Office of the Actuary, that's what ASPE and OAC stand for. They issued separate reports about probably 14, 15 months ago that indicated that the immuno bill would be a saver. And that's a huge deal because, of course, Congress wants to spend that money. So, a lot of times when something becomes a saver, it's almost automatic that it's going to get passed sometimes because then Congress can use that money to spend on something else. And the OAC number was $300 million over 10 years. So, of course, that's good news. That bill, actually, that 59 number is now 60. I just went online and saw that Val Demings, who a lot of people are pushing to be Joe Biden's vice presidential candidate, she co-sponsored that bill on Monday, so that number's up to 60, and there's 7 in the Senate. And as I noted before, the objective now is to push hard for this to be addressed in the post-election lame duck session of Congress. As I noted, the Medicare extenders package was included in that first COVID funding bill. So, and it was extended through November. So there's going to be a lot of lobbying for things after the election to be included in that Medicare extenders bill. And generally, the extenders bill will include things related to Medicare. So this would be a likely vehicle for the immunosuppressive drug bill. And you know what? I'm going to go back on that for a second and just go back to that for a second and just say, this really is the gold ring for us this year. We're so close to doing this. Everything is lined up to get this passed. So I would urge people to truly make sure that this is a focus of your visits next year. Not that all the other issues aren't important too, but next Friday, make sure you take some time to talk about the immunosuppressive drug bills. And then there's the Living Organ Donation Act. And before I go into the bullets here, I want to correct something. That the House bill number is wrong. That should be 1224, not 1270. My apologies for that. I was sure I had made that edit, and apparently I had not. So it's HR 1224, but again, it's the Living Organ Donation Act, led by Representatives Nadler and Herrera Butler in the House, and Senators Gillibrand and Cotton in the Senate. And it addresses barriers in organ donation by prohibiting the denial of coverage or an increase in insurance premiums for living organ donors, designating organ donation surgery as a serious health conditions for the purposes of the Family Medical Leave Act, and requiring HHS to update educational materials on living organ donation to reflect the changes. It's endorsed by RPA and has 65 co-sponsors in the House and 18 in the Senate. Just take a moment to talk about this. The administration did another great thing on this. I would say this is going on 2 years ago when the Department of Labor put out, I believe it was an advisory opinion saying that for their purposes, they are treating organ donation surgery as a serious health conditions for purposes of the FMLA. However, that is just an advisory opinion, and we really want to get this put into law. There's a lot of momentum to make this happen now. I know it's a super important issue to nephrologists and the patients. So this is another thing that we're pushing on. And I would say immunosuppressive drug coverage is really very close to happening. Living organ donation, this is really on the side of the angels too, so it's not impossible. This would be included in the fall package as well. I think immunosuppressive drug coverage is going to happen before that, but still, the Living Organ Donation Act, it's not impossible that could be included as well. So moving on to the CKD Improvement in Research and Treatment Act, and there are the bill numbers there. You can see the provisions. There are things having to do with ESRD, the ESRD prospective payment system. That's how dialysis facilities get paid. There's relief from the third-party payer rule. This is the charitable assistance rule that can make it difficult for ESRD patients to obtain charitable assistance in paying their insurance premiums. HHS report on barriers to transplantation, a GAO report, that's Government Accountability Office report on utilization of palliative care, funding for kidney research, and loan forgiveness for nephrologists who are serving in rural areas. Now, the thing with this bill is that I don't think anybody really thinks this bill will ever get passed. It's out there to serve as a platform for individual provisions. So for instance, I can also tell you there's a kidney disease research, kidney disease education provision in this bill. That's the type of thing that would be pulled out of this and maybe put into the Medicare extenders bill. So again, this bill is not necessarily out there with the intent that it's going to get passed. It sort of serves as a platform for other things. And you can see the examples over the years where that's happened. The home dialysis telehealth provisions, and this is pre-COVID, but those home dialysis telehealth provisions that were enacted, I think about 18 months ago, 2 years ago, they were in this bill a few years ago. The dialysis facility survey and certification provisions were passed as part of a recent spending package. So that's kind of how that works. Excuse me. And then our last legislative priority for this year is oversight of the CMS nephrology quality measurement process. And we're, of course, completely committed to quality measurement. We're the only group in nephrology with a qualified clinical data registry. However, in, say, the last 3 to 4 years, it seems as if CMS is not laying out the process that it's not following the process that they laid out themselves for developing and reviewing quality measures. And they've done things like they've eliminated the nephrology-specific measures. So nephrologists now are getting measured on things like smoking cessation. Now, not that people should be smoking. It's good to get people to stop smoking, but is that really a nephrology-specific measure? Of course not. They've increased reporting burdens with no clear benefit to patient care, finalized acute kidney injury measure despite everybody in the community saying that they shouldn't, and it's diminished the significance of the QCDRs. So we're urging Congress to exercise oversight authority on this. And I want to be clear, we don't want them to pass a bill. We don't want them to legislate on this. We don't want Congress getting, overly involved in quality measurement at CMS. However, we do want to hold CMS's feet to the fire to do what they're supposed to do and not ignore their own processes. Excuse me. In terms of other relevant legislation, there's a bill called the Lost Opportunities to Supply Transplantable Organs, the Lost Organs Act. Apparently, that's been a bit of a problem in the organ procurement and dissemination or distribution process. So this really isn't a bill that's intended to pass. I think it has one original sponsor and one co-sponsor in the Senate. I think a bill like this gets introduced when the Senate wants to send UNOS and the transplant centers and the groups involved in that a message that you better minimize organ loss because we know this is an issue and we're watching you. So, but that is out there right now. The second bill is the Patient Access to ESRD New Innovative Devices Act. You can see the bill numbers there. RPA supports this bill, and it requires CMS to establish a process for making payment adjustments in the prospective payment system for innovative devices. We're always trying to support innovation because, of course, kidney disease has been a sector where there's been precious little innovation, so we're trying to make that happen. The third bill is another one that RPA has endorsed, the Healthcare Workforce Resilience Act, and this captures unused visas for use by international medical graduates and lifts restrictions on the services they can provide and where they can provide them. I didn't realize they were restricted until I dug into the details of this bill and learned more about it. But this would be a great thing to pass. It would certainly bolster the physician workforce in the U.S., so that would be a good thing. And then finally, there's a discussion draft floating around the Hill for something called the Bringing Enhanced Treatments and Therapies to ESRD Recipients, the BETTER Act. Isn't it great how the Hill always comes up with awesome acronyms for their bills? But anyway, the BETTER Act, and this is the next generation of the ESRD Patients Act. There's no introduced bill yet. This is a legislation that would create entities to provide value-based care primarily in dialysis settings. That sounds like it's on the side of motherhood and apple pie, although there's a lot of concerns that this would cede too much control to the dialysis company. So RPA has not taken a position on this yet, and I know AAKP is pretty strongly opposed to it. I only put it on this list just so that people know that it's out there. It's not impossible. You could get asked your opinion about this during your visits. In terms of telehealth, this is our take, and I'm not going to read this whole thing here, but a lot of groups are being asked what what they would do about telehealth, because there's a lot of talk that they got to extend everything that's in place now for the purposes of the public health emergency, that they should extend it for a long time. The first bullet, is about keeping the current policy in place till we can figure out what works and what doesn't. I can tell you that the American College of Physicians, for instance, has said the current policies should be in place until the end of 2021. So that's 18 months they're saying it should be out there. That might be a heavy lift policy-wise, but there are a lot of people saying keep these current policies in place for a long time until we can figure out what's good and what's not. Now, I would say the one thing that's been a sea change in telehealth are the originating sites and geographic limitations, and the fact that they were lifted pretty early on in the public health emergency. We believe they should be permanently eliminated. There was a lot of services on the approved telehealth list before the public health emergency, but the problem was that the originating site and the geographic limitations meant that it probably was only available to like 15% of the country, and that sort of defeats the purpose, I think. So the idea is permanently eliminate those restrictions. That the administration should take steps to ensure that patients can meaningfully access technology necessary for telehealth. These would be things like expand broadband to make sure that people can actually use their telehealth, that the Wi-Fi is good enough and that the signal's good enough, and also talk about the actual technology in the patient's hands themselves, like find ways to facilitate that patients can use the technology that they have or obtain technology at little cost so that telehealth can happen. There is this concern that, and I can tell you, particularly among Democratic offices in the House, that we can't just let everything go. There should be guardrails, because this could really open up the floodgates to among bad actors for fraud and abuse in telehealth. So, we're saying that the administration should develop guardrails to make sure that doesn't happen, and then figure out some other things that need to be evaluated, like remote patient consent, allowable technology for telehealth services, interstate licensure. So if say the providers in West Virginia and the patients in Virginia, they don't have to travel to make sure that the interaction that they're having is compliant. Okay, in terms of the logistics for the day, so shifting away from the issues and moving back to moving into logistics, I should say. The delegates are by state. Some are bigger than others, and these are the usual suspects on that: Maryland, Texas, Florida. In large delegations, the constituents should lead the discussion in the House office as if the delegations stay together for all those visits. Of course, as usual, we've paired patients and physicians as often as possible. There is nothing like the patient-physician combination when you're doing advocacy, when you're doing a lobbying visit. So we've tried to make that happen as much as possible. And neighboring state advocates have been paired at times as well. I know, for instance, that Washington State and Oregon are together, South Carolina and North Carolina. So we put you together in teams, but it doesn't have to be that way necessarily if time does not allow. So if, for instance, you're the South Carolina person and there's a North Carolina visit and there's something else you have to do at that time, you can work that out with your partner and say, listen, I'm going to have to miss the 2 o'clock or something like that. But if you'd rather be with somebody, then this facilitates that. Now, what do you do before you get on the phone? You want to gauge the environment and tailor your message. Now, I always use the most obvious example, but you're not going to go into Mitch McConnell's office and say Medicare for all is something you absolutely have to do, or you're not going to go into Nancy Pelosi's office and say repeal Obamacare. So you want to tailor your message. Think about the office that you're meeting with, and check the sponsorship sponsorship status on the legislative priorities. We included these in your resources. I believe it's the special notes section of the screens that Lincoln was showing earlier, but they will be included there. So what you can do, I sorted them by alphabet. So you can click on, I did it for the immunosuppressive drug bill and the living organ donation bill. So you can just click on what's there. And if you're going into, you know, Chris Van Hollen's office, you can click on you can click on the Senate versions of both of those and see if he sponsored either one of those bills. And of course in the House as well. And of course that means that when you get there, you say, thank you, Senator Van Hollen, for co-sponsoring the immunosuppressive drug bill, or we noticed that you haven't been able to do that yet. We'd really appreciate your support on that bill. So, but you can check those out. That's going to be in your resources. And then you want to prepare your message, determine the lead speakers in advance. You can do that. You can do that. And Lincoln had talked about getting on the call a couple minutes early. You can do that then. Highlight the links to the community, you know, about where you work and the communities you work in, the health centers you work in, the places where you receive your care. Use real world examples, of course. Immunosuppressive drugs. Physicians can say, I know patients who lost their immunosuppressive drugs because they couldn't afford them once the 3 years was up. Or the patients can say, I have a friend who, lost their coverage or is in threat or is, in danger of losing their coverage for this. Talk about it that way. And then anticipate counter arguments. I wouldn't think there's going to be too much of this, but you could have some people say, well, I thought Obamacare fixed immunosuppressive drug coverage. And you could say, well, no, there's still a good number of people that aren't covered by that. Or, also, maybe the Department of Labor already fixed the living organ donation piece. And you could say, well, no, but we want to make sure that's memorialized in law so we don't have to worry, don't got to worry about whether the next administration would change that if they wanted to. Excuse me. So what do you do when you get there? You introduce yourself, you advise the staff that you're here to talk about kidney disease, and you tell your story. It's just a conversation. I'm here about kidney disease. These are some issues we care about. Let me tell you why it's important to me. I'll say this for first timers, it's really easier than you think. It's just about having a conversation with somebody, and that's really all there is to it. In terms of what gets a congressional office's attention, of course, your patients and your physicians, their constituents. It's something that's important to think. Everybody who's going to be participating in our Hill Day is an influential person. Every one of you are, whether you're listening to this live or you hear this next week on the YouTube channel, you are all influential. Either your patients who have a lot of friends and a lot of people in your healthcare networks who you interact with and in your communities you interact with every day, or you're a physician or somebody who works in a physician's office, is employed by a physician who sees a lot of people every day. So you are influential in both in your practices or your locales and in your community, and that's what gets their attention. You talk about this is where we're at. Talk about your practice in your healthcare delivering environments. You can talk about your day. Of course, you want to be careful. 15 minutes is what you are slotted to have, but talk about those things. And then the other thing that gets the congressional office's attention is your ongoing participation and engagement. And I think of people like Paul Conway or Dr. Rebecca Schmidt from Morgantown or Joseph Flynn from Seattle. These are people that get called by their elected representative staffs to say, listen, we heard about this proposal on XYZ in kidney care. What do you think? And the reason why is because Dr. Schmidt and Dr. Flynn and Mr. Conway have been interacting with their offices forever, and they know him. They've developed a relationship. So your ongoing participation and engagement is critically important. So make the best case. There's always the KISS, keep it simple, Seymour. Keep it short, keep it simple, make it personal, listen carefully, and follow up. Of course, the short and simple, we got asks like the immunosuppressive drug bill or the living organ donation bill. You just say, please sponsor this if you can. And if you've already sponsored it, thank you. And thank you. And, do everything you can to get this passed. Of course, lending your personal touch to these issues, once again, is very important. Listen carefully. And I will tell you with the listen carefully thing, don't feel you have to answer questions. I mean, don't feel if you don't have an answer, you have to come up with something. If a Hill staffer asks you, well, what about XYZ? You say, you know, I don't know that much about that, but I'm going to find out and I'm going to get back to you, and get back to them. Follow up with them and let them know what's going on with whatever issue they asked about, what your take on whatever issue they asked about is, and that's a way to influence the process. So next steps and follow up, get the contact information, write a thank you email, invite members of Congress and staff to your practice, your dialysis facility, or your locale, you know, wherever that might be. And of course, that's when it's safe to do so. Absolutely write the thank you email. And I'll tell you what, if you have a really good interaction, and it's, say you're talking to the health staffer, see if you can find out who the chief of staff is and CC them on it, because then you're telling them your staffer did a great job. We love the meeting we had with them, and that'll make them remember you, I promise. As noted before, address unanswered questions. If there are questions that come up in the course of the meeting that don't get answered, you know, make sure you get back to them on them. Again, stay in touch, and please provide feedback to us via the e-survey to RPA. You'll be getting that in the week or so after after Hill Day. So in terms of social media, of course, we want to get the word out about this as the day's going on. You know, RPA's Hill Day actually trended, and a lot of thanks to AAKP for this. But we trended on Twitter about 2 or 3 years ago, maybe last year, 2 years ago, I can't remember. But we were actually trending for about an hour, which was pretty exciting. But we want to get the word out on this. So whatever your medium is, or whichever mediums you use, Twitter, Facebook, Instagram, LinkedIn, whatever, please make sure you weigh in on those social media platforms. Use the hashtag RPA advocacy, and please make sure you tag at Kidney Patients is AAKP's Twitter handle, and at RPA Nephrology is the one for RPA. So, you know, I always have this little quote in here, and God bless Margaret Mead, never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. But bringing this a little later into the 20th century is the quote from Pink Floyd, all in all, it's another brick in the wall. And the reason I use the brick in the wall analogy is because, you know, that's kind of what we're doing here. You know, living organ donation might not get passed this year, but we're laying bricks in the wall. So 2 years from now, when it does get passed, it's going to be the work that we did in 2020 to help that happen. So, you know, it's the brick in the wall concept of, you know, we're contributing to when this happens later, you know, in the future. So with that, follow me and RPA on Twitter, at RPA Nephrology, and at Robert Blazer 1. As I've always said, I wouldn't encourage anyone to ever get on Twitter, but if you're already, do it. There's the hashtag again. And also, if you don't follow at Kidney Patients for AAKP, please follow them as well. And with that, that's my presentation, Amy. I guess I'm not sure how this works. I'll give up the remote back to Steve, and maybe you want to handle the questions.
Thanks, Rob. We do have a number of questions for both you and Lincoln. So let's just dive in. Our first question is asking for clarity on the immunosuppressive drug bill. And the question is, if a patient younger than 65 gets Medicare because of ESRD, but then gets a transplant, are the drugs covered for life as Medicare paid for transplant, or does the coverage stop in 3 years?
Can you hear me?
Yes.
Okay, sorry. You know, great question, and I'm not positive what the answer to that is, quite honestly, but we will find out the answer to this. I think it is covered for life after that because it is a Medicare covered transplant, but I don't exactly know how that works with, say, like Medicare secondary payer, so I'll have to find out the answer to that. But thank you, great question.
Our next question is whether you think Navy medicine telemedicine care plan could be used as the best practice framework. It's been used for 30 years and works well, if you're familiar with that, or if you would like that person to send more information.
Yes, please send more information. I can't say that I'm familiar with that. You know, Amy, could you please ask a question I could answer, please?
Our next question is, how often does RPA participate in Hill Days?
That's an easy one. Well, we have our own Hill Day every year. We've participated. There's community Hill days that happen that are organized by other stakeholders in the community, other nonprofits or other coalitions. We participate in those as well. We're in a broad kidney coalition. We participate in their Hill Day. There's a vascular access coalition. We participate in their Hill Day or their advocacy activities, however they happen. There's kind of a broad nonprofit Hill Day, usually in the fall. We participate in that as well. So how often? I'd say probably 4 times a year, something like that.
Great.
But, you know, we're doing advocacy 24/7, but in terms of Hill Day specifically, that's it.
Great, thank you. I think our next question is probably collectively for both you and Lincoln. There's a number of people that are interested in getting together with their fellow group to huddle or just have a little action plan for the 26th. They want to know if that's something they can do through that Prime Advocacy app. Can we share the numbers? How would you suggest they go about doing this?
So you're not able to communicate with each other through the online platform. I will turn it over. I'll punt to Rob in terms of how he would like contact information shared with the different attendees.
And we do want to be careful about sharing contact information. I know there's a lot of groups have concerns about that. I'm going to have to huddle with Aaron from AAKP and figure out the best way to do that. But we'll try to figure out some way to make that happen, particularly for the large groups. But great question. Thank you.
Can you give us an idea of approximately how many calls each team will make throughout the day?
I'll go ahead and field that, Lincoln. You know, it sort of depends on the information that was provided. You know, the minimum is usually 3 that you do your, excuse me, you know, you would do your 2 senators and your member of the House. Now, if the delegation is more than that, and you have like people from a state that have 3 different or 4 different congressional districts, and that number would go up by the number of congressional districts. So it could be, you know, 4, 5, 6, something like that. I know as Florida, we have a lot of representation, but and I think that's 9 people, but a lot of them might be in the same congressional district. I mean, I would guess the maximum is something like 6 or 7, and the minimum should be about 3. But I have to say 3 is not guaranteed, because sometimes for whatever reason, you know, the office on the Hill gives you the stiff arm and says we're not doing meetings that day for whatever reason. So so usually minimum 3, and I would guess up to about 6 or 7.
Yep, I'm looking at it now. I'm looking at it now, Rob, and yeah, it's between 3 and 7. So
3 and 7. There you go. Thank you.
Great, thank you. I want to encourage people, you can continue to ask your questions via the Q&A. Just a note or two while we wait for new questions, that we will send all this information out to you after today's webinar, including a recording of the webinar, but also links to the Prime Advocacy platform. So that's the app. I can also put that in the chat box for you right now. But just as you know, you will be getting more information from us shortly, as well as all the things we've identified as follow-up issues. Our next question is it pertinent due to COVID that there will be more kidney disease and transplants necessary in the future? And should we add that to our discussion regarding the timely need for taking action on the proposed bills?
Great point. Might be somewhat granular for the people you're talking to, but maybe not. I would encourage you to fold that in if you can. I mean, I know that COVID has had a disproportionate effect on kidney disease, so I think that's perfectly relevant to bring up and probably useful to argue for to advocate for the points you want to advocate for.
Great, thank you. I'll give another minute for people to finish entering questions. If not, we will end a little bit early. While we're waiting, I just want to thank everyone for their time today. I'd also like to take a moment and remind people that if they're interested in continuing in policy advocacy and leadership discussions, we welcome your participation in our online virtual event on June 27th. This is a no-cost event by RPA, so you can still register for that on the RPA website, which is renalmd.org. Sorry, I'm reading another question at the same time.
And Amy, I got a couple comments to make too.
I certainly
Sure. First, I will be sending a link to the YouTube video of this webinar out before the end of the day today, and then it'll be posted on the RPA website probably Monday. And I'm also, Paul Conway, I just saw something that came up in the chat. It popped up on my box. He asked the question, are we going to set a record for this? And yes, we will be setting a record for the most participants and the most states visited. So give yourselves a hand, as they used to say in the old rock and roll shows.
So one or two other questions have come in. So the next is, how do I join the physician or patient team for Hill Day?
How do you join? Well, you know, you're kind of assigned, Lincoln, help me out here if I'm not, I mean, you're kind of, you know, based on the state you're from and your congressional district, it's sort of done for you. I mean, in terms of joining, I don't know if you're asking if the question's about calling in. I mean, once you call in, you're sort of on the call, and ahead of time, you can look at your assignments and see who else is on your team. So maybe I'm not understanding the question, but that's, to a certain degree, that's done for you.
Yeah, everyone's been placed into a team. So once you log into your schedule online, you'll be able to view your schedule. If anybody's having issues logging in, we'll take a deeper look and make sure that you're an attendee and that you're registered. But everybody should have a schedule that's live as of right now.
Great, thank you. Just a few points of clarification. All the times in your schedule are Eastern time, so please convert them if you need to, as Lincoln, I think, had mentioned earlier. And we will follow up with the ideas of how you can reach your fellow colleagues that you're grouped with. And Rob, any further closing remarks from you?
I guess specific questions about your participation in Hill Day after the webinar, why don't you go ahead and send them to me, and I will do my best to get you an answer ahead of time. But you know, again, we have a week, so if you have any questions or concerns about how this is going to work, shoot me an email and I'll try and get back to you pronto.
Great, thank you, everyone. We would like to thank you all for joining us today. And as we said, we will follow up as indicated. And in the meantime, be safe and stay well. Thank you.
Thank you, everybody. Take care.